A very good afternoon to all of you. As mankind is making rapid advancements in all spheres of life, we find that along with the progress that we make in our endeavors towards newer discoveries and ways to better our lives, there are certain fallouts which occur. If unrecognized or left unattended, these can cause harm and have undesirable effects on both man and his surroundings, the environment. Progress is a must and change is inevitable. These will be forever ongoing. We have to look out for any collateral damage that our actions might cause and find ways of mitigating them, if not completely eliminating them. Modern ophthalmic practice, with all its remarkable achievements, also contributes significantly to environmental pollution. Today, we depend heavily on electricity and energy that is produced partly from fossil fluids, fuels, paper that comes from trees and bamboo, plastic, some of which may not be easily recyclable. Dr. Madhukar Reddy has dealt with the facility design and management, and the speakers to follow would be dealing with the other aspects of surgical management, education, research, diagnostics, community aspects of green ophthalmology. I will confine myself to the management of medical and optical facilities in a small setup. Typically, a small setup would consist of a facility and personnel and equipment, items that we commonly use, medicines and others. We have paper, cotton, gauze, protective equipment, gloves, PPE, sanitizers, masks, disinfectants, and medicine that we use on a regular basis in our consultation and the hospital rooms for various functions that we have to do. We also have UV lamps, which contribute significantly to the gas that they emit. Our resources are only finite in this planet, and we have to use them judiciously so as to sustain. The basic principles for reducing our carbon footprint would be reduce, reuse, and recycle the available resources and increase the efficiency of the system without compromising quality and the safety for both the patients and the personnel. Optimal utilization of a facility and the personnel can be achieved by way of appointments through the day so that crowding or waiting is minimized. Reduce the number of visits by the patients because each visit costs in terms of money, in terms of time, as to the pollution by way of commuting, and also because there's increased use of PPE and disinfectants at the center. Completing the evaluator process in one go would be the ideal goal. Teleconsultations should be considered wherever it's feasible for a follow-up. And one more idea would be to have encouraging the neighborhood clinics. Group practice and multi-subspecialty availability under one roof with staggered timings will help to put both the personnel, space, and equipment to optimal use. Moreover, regulatory credentials and processes need not be replicated at multiple locations, which means effectively that there's greater control of costs and there's avoidance of wastage of resources while quality is maintained. You know, the equipment that we use, you've gone back. Yeah. The equipment that we use is both ophthalmic and non-ophthalmic. I will not go into the ophthalmic because that's something that all of us know, but the things that we have controls over are the non-ophthalmic instruments that we use. You know, today, apart from the ophthalmic, we use a lot of we are dependent on computers and assorted other gadgets for a considerable amount of, which involve a considerable amount of usage of paper, printing ink, and stationery. We can reduce the usage of paper considerably by switching over to electronic record keeping and communications, whether it is to communicate with the patients or issuing prescriptions or communicating with the referring doctors or the pharmacy or the optical stores. And wherever we have to use paper, it would be a good idea to use recycled paper. And then EMR. EMR is something where we use it routinely now, and it's a great tool. It makes an office potentially a paperless office. Records are maintained in a very organized and systematic manner, and they can be accessed from anywhere at any point of time. As we all know, it's a very important tool for our research and analysis. You know, some of the things that we use very commonly in our, one of the most important things that we use now is the electricity and power. Now, without this, there's no way we can function. We use it at every step of our work, for our equipment, for lighting, air conditioning, fans, coolers, refrigerators, heaters, etc., etc. Reducing the consumption of power is essential because this can be achieved by simply switching off to more efficient bulbs, using 5-star rated appliances, switching off the appliances when they're not in use, and we have now technology in the form of sensors which will help us to achieve this without much ado. Going solar, as Dr. Madhukar said, is a wonderful option. And with costs of rooftop panels, wall panels, window panels coming down, it is now an attractive proposition. The PPEs and protective equipment that we are now having to use in greater quantities because of this pandemic, ongoing pandemic, hopefully we'll be reducing this usage in future, and that would be very, very good for the environment. We need to discourage and the use of plastic cups and bottles and spoons and plates that we use in our cafeterias and our day-to-day activities as in our lunchroom. Now, if we can dispose these off in a good way and have them recycled, that would be wonderful for the environment. You know, we use a lot of medicines. We use a lot of medicines, and in our day-to-day activities, a major source of waste generation in ophthalmology is the use of ocular medicines and the vials that they come in. Chronic conditions like glaucoma, chronic eye disease affect a significant proportion of our patients and population. These people may need medication multiple times in a day for long periods of time, and their effects on the ocular surface due to the preservatives used in them has necessitated a shift to the preservative-free medications. Now, these usually come in single-dose uniforms, and that adds to the plastic waste. The usage of contamination-free vials, which deliver micro droplets or microdrops or measured doses so that the drug wastage is minimized, would be a step towards reducing the plastic waste that we generate. But making it cost-effective is at the moment a challenge. If we can come up with safe, sustained release drug delivery mechanisms, it would go a long way in greening ophthalmology. The tubings, the packaging materials, the labels, the foils of our IOLs and irrigating fluids, etc., leads to generation of enormous waste that goes into landfills and can remain there for many decades. We need to find a way of having these recycled so as to reduce the piling up of such waste. The pharma and manufacturing industry need to be sensitized in this regard, and their help has to be taken. If we can have biodegradable plastic on a mass use, that would be probably an answer to this vexing problem. The optical management would be, you know, inventory is a major issue in opticals. With fashions and trends changing quickly, it is a good idea to look at technology-driven initiatives like the animated 3D models, wherein one need not have a large inventory. This relieves the pressure on both space and cost. Ideally, we need to encourage longer use of spectacles and change them only when needed, and recycle the used spectacles if it is possible. These days, a large percentage of contact lens users prefer the disposable variety. Undeniably, they have their benefits, but we should try and encourage at least the first-time users to use the daily wear lenses and also try and reduce the frequency of the disposable variety. All these are changes that we can adopt in our daily life and our daily work. They may appear to be small, but don't we all know that it is these little drops of water that make the mighty ocean? We have only borrowed this planet from our future generations, and it is important that we pass it on to them in a better condition than when we received it, if that is possible. At least let us not harm it if we are unable to help it or make it better. Let us all plant trees and nurture them so that they grow well and they help us in reducing our carbon footprint. I thank the AIOS for giving me this opportunity, and I thank you all for this patient listening, hearing. Jai Hind.